So I'm really happy I get to speak to you guys today about this very important topic. As you know, nationwide we are in the middle of an extremely busy flu season, and Florida, Alachua County, this local community is no exception. We are seeing unusually high levels of flu activity this year compared to last year. We are also seeing a lot of visits to our emergency department this year as well. So I wanted to let you guys know about what are the signs and symptoms of flu and what are your options for care. So influenza is a little bit different from a lot of other respiratory infections because it often comes on you very suddenly. So people sometimes can even say, I was feeling fine, and then after lunch I had the chills, the shakes, and I felt terrible. That's pretty characteristic of influenza infection. People who even have a little bit of a slower onset will oftentimes get worse pretty rapidly, and that's very different from the common cold, for example. So other symptoms that go along with it would be coughing, sneezing, you can have a runny nose, you could have a fever. Not everyone has fever though. Body aches, headache. Some people will also have nausea, vomiting, or diarrhea as well. So you can be pretty miserable when you get the flu. However, though, you have a lot of options for care. So if you have a primary care doctor and you have these symptoms, you should call your doctor to make an appointment. And if you are tested for flu, or if the doctor thinks that you should be treated, you will be given an antiviral medication. If you don't have a primary care doctor, though, you can go to, there are numerous urgent care and walk-in clinics around town, and they have the capability of diagnosing and treating flu as well. Now, if you're somebody who has some serious underlying conditions, or if you feel that you are really very severely ill, and pregnant women who get sick with flu also, you may consider coming to one of our emergency departments. Now, keep in mind that if you come to our emergency rooms and you are not as sick as some other people, you might experience a pretty long delay before you're seen. And that is just simply because there are a lot of extremely ill people that are being seen in our emergency departments. At this point in January, we've had over 400 positive cases of flu that we have seen here at UF Health. That is a lot more than what we've seen in prior seasons. About a quarter of those people are ill enough to be admitted to our hospital, but that also means that 3/4 of people actually can be sent home to recuperate at home with antiviral medication. So we would ask then that before you come to the emergency department, you first call your primary care doctor, unless, again, you are severely ill or you have some underlying conditions. And certainly if you have any trouble breathing, you should call 911. You shouldn't even wait for that. So in order to try to get a handle on flu here and to keep our patients, our visitors, and of course our staff as well, as safe as possible, we are instituting some additional safety measures at UF Health. So the first thing that we are doing is we're going to restrict the number of visitors that a patient can have. And the reason for this is that we want to try to limit the number of people who might be infected with flu from coming into the hospital. Flu is a really tricky virus in that you can be infectious. In other words, you can transmit influenza infection a full 24 hours before you have symptoms. So that means if you look to your left, look to your right, the people around you, one of them could be incubating flu right now and feel perfectly fine and could be transmitting it. So that's the reason why we really want to limit the number of visitors that are coming into the hospital. We are also encouraging people to wear masks when they are in the hospital as well, because that will also help to cut down on flu transmission. If you come to the hospital, though, and you are visibly ill, and you are not there as a patient, but you're accompanying a patient, we're going to ask you please not to visit, because again, we are trying to limit the spread of flu. So the other thing that we are going to be asking people to be aware of is that we're going to also restrict the visitation by children in the hospital. And there's a few reasons for that. Children can transmit the flu just like adults can as well, but it's very difficult to get especially small children to wear a mask properly just because their heads, their faces are smaller as well. And again, in order to keep people as safe as possible, we want to limit that. If you'd like, I can show you the way to wear a mask that you will be offered when you come to visit at the University of Florida. So the masks just look like this. We call these ear loop masks. And what you do is you apply it to the front of your face, slip the ear loops over each ear, but now you have to expand it a little bit up and down because you want to fully cover your nose and your mouth. The last thing you want to do is to pinch the nose part here. So you have a pretty nice seal going all around your mouth and your nose. And this is the way we're going to be instructing our visitors to wear masks. Another big part of trying to prevent the transmission of flu is going to be hand hygiene. So in numerous places throughout the hospital and throughout the hospital units, we have alcohol dispensers for hand gel. And so using this hand gel is going to also help reduce the spread of flu, since we know it can be transmitted in that way as well. So with that, I can take any questions that you may have.
When you say you have more than 400 people, now that it's been January, or end of January, are you saying from the winter season, like starting in 2017, or are you saying starting from January 1st?
Since January 1st until now, we've had over 400 positive cases of flu.
What's a normal January like?
Well, I would say that every year flu peaks at a different month, you know. So for example, 2 years ago it peaked in March, you know. So I would say during the peak month for flu, we would see perhaps 300, maybe 350, I think might have been our last peak, our highest peak prior to this year, recognizing though that the month is not over and we've already had over 400. So this is the most we've seen in quite some time.
As for safety measures, you're not talking about patients that are being treated for flu, you're talking about all patients would have restrictions, right?
Yes, exactly. We're talking about restricting visitors for all patients.
And what are you guys, as far as like locally, what's a average treatment for an extreme case?
So that we really only have, there's only one game in town really to treat influenza, and that's the antiviral medication called oseltamivir. The trade name that people might be more familiar with is called Tamiflu. And it is a pill that is taken. For children, there's also a liquid form.
Is it too late to take a vaccine?
No, it is not, I can say it's not never. It is definitely not too late to take the vaccine. We strongly encourage people to get vaccinated because that is our best method of prevention of the flu. The flu vaccine contains 3, or depending on where you get it, 4 different strains of killed influenza. So it offers you broad protection against all the strains that are circulating as well. It's very important to keep in mind that contrary to what people may often think, you cannot get flu from the flu shot because the virus is dead. So a dead virus can't make you sick. Your arm might feel kind of sore, but when your arm is sore from a flu shot, that's a good thing because that's because your immune system is responding to the vaccine and mounting an immune response to it. So I strongly encourage people who have not gotten vaccinated yet to get vaccinated as soon as possible. You can get that at your primary care doctor, at these urgent care clinics as well, and Department of Health. Is there anything?
Is there a threshold level as to when you should seek medical care or try to treat it at home?
So most people can be treated at home. So most otherwise healthy people can be treated at home. However, if you, excuse me, most people can be treated at home for flu. However, if you go to your physician and it's within the first 48 hours of when you've gotten symptoms, you can be prescribed this oseltamivir or Tamiflu, and it will help to shorten the duration of your illness and may help decrease the severity of your symptoms. So it's worthwhile to go see your primary care doctor if you think that you have influenza. But again, most people don't need to come to the emergency room necessarily, and only a fraction of those people who do will require admission.
For the people who are treating it at home, how would you suggest are simple ways that they can keep from spreading it within their home?
So one of the best things you can do at home is the same thing that you would do when you're outside of the home, and that is really good hand hygiene. So using soap and water or any of those alcohol-based hand gels is a really good way to do that. You also, if you haven't been vaccinated for flu, but you got the flu, you should still get vaccinated. Because like I said, depending on which vaccine you get, there's between 3 and 4 vaccine strains in it. And when you get the flu, you just get one. So you're still at risk for getting one of the other ones that are out there. And we've seen that in the past, people getting flu more than once in a season because they're getting infected with a different strain that's circulating.
When is somebody contagious with the flu?
So people are contagious with the flu a full 24 hours before they develop symptoms.
So that's sort of a problem with prevention, because you could be around somebody that has the flu and they don't know it, and they could be spreading germs.
Yeah, so that's the problem with influenza. It's a tricky virus. You are infectious a full 24 hours before you develop any symptoms, and that makes it hard to prevent. So that's part of the reason that we are implementing additional measures here at UF Health to try to keep everyone safe, restricting visitors, masks, and encouraging, as always, hand hygiene.
Do you have any advice for schools with particularly younger children of ways to prevent influenza, especially like little kids who put their hands in their mouth or touch the playground?
Yeah, so we're very fortunate here in Alachua County anyway, because we have the school vaccination program. So a lot of our children are already vaccinated. So that's a really, really great thing. For children that have not been vaccinated, again, I would strongly encourage parents to have their children vaccinated as soon as possible. There have been an unprecedented number of pediatric deaths due to flu in Florida. There's been over 30 so far this year. In past years, it's about 10. So to see 30 is really, really important and to notice, and it is very alarming. And again, the best way to protect from getting it in the first place is vaccination. The other thing that vaccination does for you is it lessens the severity of the illness. And this has been shown in a lot of different studies. So that could be the difference between being able to take a pill and go home versus having to be admitted because your breathing is so impaired. So vaccination is really important, not just to prevent flu, but to decrease the severity of it.
And when you said 30 deaths for pediatrics with the flu, how was that from January 1st? Or
It's from the start of the flu season. So that's been since this year's flu season,
Okay.
yeah, in 2017.
Okay, thank you.
Mm-hmm.
Are there other crippling viruses out there at this time, Dr. Iovine?
So for the pediatric population, we're finally getting over the peak of the respiratory syncytial virus season, RSV, which is another serious viral infection, again, that principally affects the pediatric population. Fortunately, that is on the downslope. However, as of right now, influenza, we have no sign yet that it is decreasing or even plateauing yet. So that's why we want to try to mitigate the effect of increasing flu by taking these additional steps at UF Health.
Did you already discuss how to tell the difference between a severe cold and the flu when you're at home trying to decide if I should go in for medical treatment or just kind of ride it out?
So there are some differences in the way the flu will present compared to other respiratory viruses like the common cold. So if you're coming down with the flu, what typically happens is that you will feel symptoms rather suddenly. Some people can even pinpoint the moment at which they had a shaking chill and started to feel really horrible. The symptoms are, they include headache, fever, body aches, coughing, sneezing, nausea, vomiting, diarrhea can occur. If you have the common cold, typically you don't have that all of a sudden onset of symptoms. You also don't usually have gastrointestinal symptoms like I mentioned, like nausea, vomiting, or diarrhea. And again, put it this way, you shouldn't go to work if you have a viral infection, but if you had the common cold, you could imagine yourself working. If you have flu, especially if you haven't been vaccinated, you're not going to be able to go to work.
Was the strain that is so deadly this season, was it circulating last flu season too?
So the flu strain that's circulating right now, I want to be clear that we're seeing a tremendous number of cases, but we're not seeing an unusually high rate of deaths. So unlike when we see swine flu in other seasons, which is associated with increased mortality, this season we're not seeing an unusually high rate of deaths nationally. But we're just seeing so many cases this year. The thing about flu is that it mutates constantly. And we've seen this happen in the past where the flu strain that's circulating early in the season mutates and actually ends up replacing the original strain, and we see something different by the end of the season. So we're always kind of chasing our tail with flu. That's why there's so much research going on nationally to develop a universal flu vaccine that would not be subject to such changeability in the virus.
Can you talk about the impact on pets that we were talking about a moment ago, about how it transfers over to canine flu?
Well, any mammal, most mammals, can be infected with influenza. However, by far and away, the primary way that humans will contract influenza is by being in close contact with another person who is either sick with flu or incubating it. So within 3 feet, if someone coughs or sneezes on you. And then the other way, again, is if somebody has it on their hands and they transfer it to your hands, and we touch our faces inadvertently hundreds of times a day, so we can inoculate ourselves that way. Again, that's why hand hygiene is so important.
In comparison to the rest of the state of Florida, how is the county of Alachua with the number of patients coming in with the flu compared to like other places in the state of Florida?
So actually, most counties in Florida, with the exception of maybe 2 or 3, are seeing increasing amounts of flu as of right now. The Florida Department of Health website has very nice graphics which show that. So we are pretty much along with the rest of the other counties that are seeing increased influenza throughout the state.